Okay, let's get into this. Jumper's knee, patellar tendonitis. You've got these notes, and you're looking for the high-yield stuff, right? Like the absolute essentials.
Exactly. A clear rundown,
Right.
what it is, why it happens, what we do about it, basically a quick revision session.
Perfect. So let's start right at the top. What is jumper's knee?
Okay, so fundamentally it's an inflammation. It affects the patellar tendon, that's the strong cord connecting your kneecap, the patella, down to your shin bone, the tibia.
Right, that bit just below the kneecap.
Exactly there. The key things are pain and inflammation in that tendon.
Got it. And what actually causes it to flare up? Is it like one bad landing?
Usually not. The main culprit is really repetitive stress, overuse.
Okay.
So imagine landing from a jump again and again, or even just running. Those tiny repeated impacts can actually cause microscopic tears in the tendon.
Microtrauma.
Precisely. And the body's response to that microtrauma, inflammation.
Okay, that makes sense. So who's more likely to run into this problem? Is it purely athletes?
Well, yeah, participation in sports with lots of jumping or running is definitely a big risk factor. Think basketball, volleyball, track and field.
Sure.
But also things like not warming up properly, or maybe inadequate stretching. Even muscle imbalances like weak quads or hamstrings can increase your risk.
Interesting. So let's dig into that pathophysiology a bit more. You mentioned microtrauma leading to inflammation.
Yeah, and it gets really interesting, especially in, say, active adolescents going through growth spurts.
Oh, how so?
Well, that bony bump just below the kneecap, where the tendon attaches the tibial tuberosity, it might not be fully hardened yet.
Ah, okay.
So that repetitive stress can sometimes even cause fragmentation there. And sometimes the healing process leaves like a noticeable bony lump.
Wow.
And another thing, sometimes really strong quad contractions, especially when jumping, can actually pull tiny bits of bone off. They call those avulsion fractures, if the muscle strength is greater than the resistance of that tuberosity before it's fully ossified or hardened.
Right, so that pain below the kneecap, it could be a few things then, not just jumper's knee.
Absolutely. Differential diagnosis is important. We need to rule out other possibilities.
Like what?
Well, there's patellar tendinopathy, which is more of a chronic degeneration, less inflammation. A patellofemoral pain syndrome, that's more general pain around the kneecap.
Okay.
And, of course, you've got to think about ligament injuries, ACL, PCL tears, or just other causes of anterior knee pain, maybe other types of tendonitis nearby.
Gotcha. So how common are we talking here? Is this something you see all the time in clinic?
Exact numbers are a bit hard to pin down, but yeah, it's definitely common, especially in people playing those jumping or running sports.
Right.
You see it a lot in teenagers and young adults. Sports medicine clinics know it well. And interestingly, it does seem to be a bit more common in athletic teenage boys.
Okay. So what are the telltale signs? What should someone be looking out for?
The number one symptom is that anterior knee pain, specifically below the kneecap, right on the tendon.
And it gets worse with.
Activity. Yeah, things like jumping, running, even sometimes squatting or climbing stairs. It really flares up then.
What about after resting?
You might get stiffness, yeah. And maybe some pain when you first start moving again. Sometimes there can be a bit of visible swelling, and it's often tender if you press right on that spot below the patella.
That kind of chronic ache that just spikes after a run or a game.
Exactly that. And you can usually feel that tenderness on examination.
So how is it actually diagnosed? Is it straight to MRI?
Not usually, no. Mostly it's a clinical diagnosis. A doctor or a physio will talk about the symptoms, the history, how it started, and then they'll examine the knee, feel for that specific tenderness.
Okay.
Imaging like ultrasound or maybe an MRI might come in later,
Yeah.
perhaps to see the extent of any tendon damage or definitely to rule out those other things we mentioned.
Right. Rule out the differentials. Okay,
Yeah.
so let's say the diagnosis is confirmed. Jumper's knee. What's the management plan?
The first line is almost always conservative. So number one, rest, or at least modify your activity. Cut back on the things that aggravate it.
Makes sense. Stop poking the bear.
Exactly. Then physical therapy is crucial. Strengthening the muscles around the knee, quads, hamstrings, glutes, and working on biomechanics, how you move and land.
What about pain?
Pain management strategies, yeah. Ice can help, sometimes anti-inflammatories, though that's more for symptom control. And occasionally orthotic devices, like insoles or maybe a patellar strap, might help redistribute forces.
And surgery.
Surgery is generally reserved for really severe, persistent cases that just haven't responded to months of good conservative treatment. It's not the first option.
Good to know. What's the outlook usually? The prognosis?
It's generally pretty good. The good news is that with proper management, sticking to the rehab plan, most people see significant improvement.
And can they get back to their sport?
Yes, usually they can return to their previous activity levels.
Yeah.
It takes patience and consistency with the rehab, though.
Okay. But what happens if someone doesn't manage it properly or just tries to push through the pain? What are the potential complications?
Yeah, that's not a great idea. You could end up with chronic tendonitis or even tendon degeneration, tendinopathy.
Huh.
There's a higher risk of the tendon actually rupturing, which is obviously much more serious.
Ouch.
Plus, you're looking at prolonged pain and potentially ongoing limitations in activity. It can really impact performance and quality of life if ignored.
Okay, so summing up, hopefully this deep dive gives you a really clear picture of patellar tendonitis. We've gone from the cause, that repetitive stress, right through to management and potential pitfalls.
Yeah, remember those key points. Pain located just below the kneecap, worse with jumping or running, and the absolute importance of rest, modification, and proper rehab.
So the big question for you listening is, considering all these factors, what aspects of your training or activity might be contributing? And maybe more importantly, what proactive steps can you take now?
Good point. And for more resources, practice questions, things to really help you lock down topics like this for your exams, definitely check out PassTheMSRA.com.
And freemsra.com as well. Great resources there. Okay, lots to think about. Go mull that over.